I was already challenged to the Healthcare Social Media Talent Show, and I don't do any of that, at least not yet, but I do hear the challenge of Chris Boyer over there, and we'll see what we can do. Maybe tomorrow we'll do something. We're bringing the band back together. All right, so my name is Mike Sevilla, and I am a family doctor. And I'm here to tell you how to get all your physicians and providers on social media. No, not really. Been waiting for this session all day. I'm just going to share some of my story and some of my perspective. And you can see I'm out there on Twitter, and so you can tweet out the talk here. And encourage you to check out my website there, FamilyMedicineRocks.com. I'll be talking about that in a little bit. So very excited about that. Thank you so much for the invitation to come here. And New York is always great this time of year, so it's always fun to be here. So we're talking about social media. So a lot of people think social media is this, okay? And I always like to try to gauge my audience because I can hear the laughter through the room to see how much you're using social media. So yes, the joke keeps going on as people get lower down on the Foursquare, Instagram, YouTube, LinkedIn, Pinterest. Okay. So how many people are on at least one of these? How many people are on like 3 or 4 of these? All right, cool. Very good. Very good. So a lot of people think social media is this. Me trying to find a power cord at a social media conference. Okay.
Hey, I bought 6 of them.
Yeah, I appreciate that. That's on my Facebook page. It's been up 2 hours. Already 8 likes of my people that are following that. So that is like kind of the power of social media. People are paying attention out there. Okay. Are we getting some good feedback on that? So how I want to start my story. This is my story on social media and how I think I got to be here, to ask to be here. My social media story begins here. And that's me and my brother right there. Okay. And already at this age, I was already thinking about tweeting. But it was a little bit different back then. So I'm a family doc in a small town in Northeastern Ohio called Salem. And in fact, yesterday, the vice president was there to talk to our firefighters and things. It was in Youngstown, Ohio yesterday. So they're knowing about us a little bit. So I am in full-time private practice. Okay, I have a job where I see patients 5 days a week in the hospital and in my office and in the nursing home. Go family medicine. Woohoo! I'm in a group with 4 other family docs and a nurse practitioner. And yes, I do social media. I know. Ask me the time question later. How do I fit it all in? So back in 2005, at the end of 2005, I was sick, I was ill, and I couldn't work for a week. Drove my wife nuts. And I said, what is this thing that is called blogs? I was always geeky growing up, I always like all the tech type of stuff. All my friends like, what's the latest tech thing that you got there, Mike? So I was laid up for a week, and I was fascinated by blogs going all the way back to the 2004 presidential election cycle, when there was a lot of press back then about that. So when I was sick for a week, I said, is there blogs out there on medicine? Is there blogs out there written by doctors? And there was. And I'm like, this is really interesting. And back then, back in the dark ages, which is 2006, what physicians were doing back then, they were blogging anonymously without using their name. That was the thing to do. And why were they doing that? They were doing that to tell their story, whatever it was. I was fascinated by a blogger I started reading called Fat Doctor, whom I've come to meet in the past few years. She was a family doc like me, so I definitely related to her story. One of the stories that really got me was she was in her 30s and had a stroke. and she talked about it. Fascinating reading. There were some other doctors out there talking about patients, talking about all these other things. And what you've heard today, and what you'll hear all the time is social media. It's about telling stories, and that's how I got hooked into that. And it took me about 6 months. I'm like, could I do that? Why would I want to write anything? Why would anybody want to read anything that I would write? You know, this doctor in a small town in rural America. I said, oh, why not? So I went into Google, I went into Blogger, and I'm like, well, I need a really cool name. I need like something that's like really buzzy, you know, like can really like really interesting. So that's how the Dr. Anonymous blog was born. Why? Because it wasn't taken. This is my first post, June 2006. Does this thing work? 4 lines. That's how you start blogging. So what did I start writing about? What was my point? What did I want to do? What I wanted to do was I wanted to bring the reader into the exam room with me. And yeah, I talked about patients initially. I wanted to let the reader know how difficult it is to take care of patients in this broken healthcare system. What was it like from my point of view to to take care of a non-compliant patient? Oh yeah, I vented about it. What was it like to deal with an insurance company, to deal with attorneys? That's what I was doing, and that's what a lot of other anonymous physician bloggers were doing back then. And I was amazed people started reading it. People started leaving me comments. I remember when I got my first international comment, this radiologist in India. He said, I like what you're writing. I'm like, really? Why? Because we have not the same, but similar stories here about patients. So I kept writing, I was really enjoying it, and I got addicted to it. I mean, I was writing 3 posts a day. Like, my work was like, do you ever work? I mean, they say that now, but back then, because it was really good, because it wasn't just the writing part. It's the interaction. That's what social media is about. Because I don't have that much right now. This was, pre-Twitter, pre-Facebook. Where the conversation happened was in the blog comments. People remember when, back in the day, I mean, I know now the big sites have hundreds of comments, but back here, 20 comments for me was huge. It was the back and forth. It was getting people engaged in a lot of different points of view. So it started getting more popular, and then I was picked up by a national website. And they said, one of the 10 bloggers to read about. And I saw my anonymous name out there. Like, whoa. That's when things started to change. Things started to change because when you start doing this type of stuff, it's really cool when people like what you write. But when people don't like what you write, they come after you. And I didn't know what to do. I never had to deal with that before. I said, how can you be anonymous? How can you talk about patients? That's wrong. Oh, and by the way, we're an IT person, and this is your IP address. We know exactly where you're sitting right now. You're not anonymous, so stop pretending. And I almost quit. I did. I was scared. Because my practice didn't know I was blogging. My city didn't know I was blogging. My hospital didn't know I was blogging. My patients didn't know I was talking about them. So I almost quit. But my readers were like, Mike, because I did share with some of them who my real name was, we want you to continue to write. You will find a way because we enjoy your style. We enjoy how you tell stories. And we know you'll find a way how to do that. And right around that time as well, there was this very famous physician blogger. And what he did was, it was fascinating, but yet frightening at the same time. He was blogging during his malpractice trial. Yeah, really good reading. He was talking about the other attorney, he was talking about the plaintiff. It's really good. What happened? The other side found out about his blog. And in this huge Hollywood moment, they said, "Are you Dr. Flea?" Yes, the case was settled the next day. So the lessons are pretty easy. Don't blog during your malpractice trial. And don't ever talk about patients, ever, on social media. There are a lot more examples of it. I don't have enough time to go into all of it, but you know some of the stories out there. And at that point, I switched. I said, I'm not talking about patients anymore. So at that point, I started to talk about what was in the news. I started talking about current events. I tried to bring my point of view as a family physician in a small town in Northeastern Ohio, what I thought about this story. And I kept going. Then I started dabbling in some other things in social media. I started doing audio podcasts. I started doing YouTube videos. Why? Because I'm geeky. I was interested in it. I'd like to innovate. And of course I fail, at some point, but you learn from it. And then, as the years went on, some good things started to happen. And I got a call from Medical Economics magazine, which all the docs will know what that is. And they said, we want to talk to docs who are using social media. I'm like, sure, why not? So it was a really nice interview. And they said, we're going to send a photographer out. We're going to take some pictures. And I'm like, oh, all right, so maybe I'll just get a little, picture on page 15. And actually, one of my Facebook friends put this on my Facebook page when it came out. This is December 2010, December 6th issue. And it just really floored me. And one of the things that I talked about, one of the things they wanted to ask me about that is hugely discussed and debated in physician circles. Do you friend your patients on Facebook? Mm-hmm. And the discussion is all over the board. You're going to get physicians and providers say absolutely not. You can see physicians and providers that say that's fine. Me, I'm kind of in the middle. For example, if I have known this person for a long time, even before media presence or before I started practicing here, sure. But it's not a blanket policy. So I talked about that. And I got more calls for interviews and things. And one day I saw this blog post here. And for anybody who doesn't know anything about physicians and social media, these are the people that you start to read about, follow on Twitter. And I'm there too.
But you should be number one.
I'm doing number two, yeah. Yeah, the other reason is because Howard's number one, and I do anything he says. So about a year and a half ago, some of friends of mine said, Mike, you got to come out as yourself. You can't do this anymore as Dr. Anonymous. You have a message to give to people, so you should change. It was about a year ago that I kind of rebranded myself, which is a whole different discussion, but fascinating. And now I'm at FamilyMedicineRocks.com. I'm Dr. Mike Sevilla on Twitter. And what do I talk about now? I talk about things that I'm passionate about, family medicine. And how I think that family medicine has the solutions to fix our broken healthcare system. And you can read all about it. I do audio podcasts, I do videos. I've been lucky enough to have the hospital have me do some interviews about general health issues, put that on my blog. I really think that physicians need to be out there, not only in social media, but traditional media as well. So that's about me. Okay, so we're going to shift a little bit. And we've talked a lot about patients. Okay. And if you haven't heard about e-patients yet, you should. So e-patients are, whatever the E that you want it to stand for. Electronic patients, empowered patients. And for the docs, when I tell physicians and providers they're going to be in your office if they're not in your office already. And I tell physicians and providers, it will be patients that drive physicians and providers to use social media. Every single day in my office, I have patients bring me something. Say, Dr. Sevilla, what do you think about this? I found this on WebMD. I found this on this site. Is this a good site? Is this a bad site? I said, well, maybe it could be a biased site. What does biased mean? We talk about that. Social media is a way to engage dialogue with your patients. And I have a lot of physicians say, I don't want to do that. Well, e-patients are here. You have to figure out how that you're going to deal with it. I have a couple videos I'm going to show here illustrating some e-patients. Okay. This first one is my good friend Carrie Sparling, and for those of you in the diabetes community, you know her as 6untilme.com. At age 6, she was diagnosed with diabetes. That's the name of her site. And what does she do? She started her blog because she thought she was the only person in the world with diabetes. She wanted to reach out to see there are other people like her. And if you go to her website, she has some great stories. And one of the most amusing things that I've read about her is answer this question. How do you hide an insulin pump in a wedding dress? If you're a physician or provider, could you answer that? No, I know I couldn't answer that. Did you put that up? Boom. All this feedback out there. Patient support workers have been out there forever, okay, but now they're on the internet, and they're worldwide. I'll play her video here. This is a funny video that she has here.
The noise. You know the noise I'm talking about. That song that the pump plays when it has issues and it needs something, wants to be primed or wants a battery or needs a hug or whatever it needs. That noise, that song is ingrained in my head. It's Pavlovian. I mean, I hear it go off and I immediately get angry. So I needed to switch things up to keep my sanity sane. So what I decided to do was to finally make use of the software. My first goal was to make a logbook, and like a real logbook, one that I look at on a week-to-week basis, not something that I jot down, feverishly in the endo's office. You switch pens that you're using, and you try to like crinkle the edges of the paper so it looks like you have been keeping this logbook for years, and it looks so tattered, like a pirate's treasure map. But it's not. It's the logbook you started and finished while you were sitting waiting in their office. You know the drill. That was the first thing I did with the software. But the second thing I did, and this was the part that oddly enough was most important to me, was I got rid of that song. I wanted to change this song, but I didn't have the owner's manual handy because I just didn't have it out that day. So I went online and I Googled how to change the song in my Animus ping, and lo and behold, someone on 2diabetes.com had the answer, so I read through the thread, and I was actually able to change it within just a couple of minutes, and there were all these other songs uploaded in there too, so now I have plenty of options for when the beeping starts to make me mad, and not mad in like an angry way, mad in like a lunatic way. My pump is now not just trilling at me, it plays 80s music, and that brings me great unadulterated joy. I love my new song. It's reignited my diabetes techno joy. So now I can change the song whenever I feel like it, which is important because when this thing beeps at you, you need to listen and you need to take into account what it's asking you to do. This thing is with me all the time, so it may as well be customized. It may as well be something that makes me happy. And it's up to me to take the steps to make it mine, So now my biggest concern is making sure that the ringtone on my phone and the spazzy noise on my pump are not one and the same, because otherwise it could get confusing on one end of answering my pump if it calls, Hi, how can I help you? Oh, sure, you're looking to speak with my pancreas? Yeah, I'm pretty sure it's not busy. Hang on. I'm glad there are ways to actually make this feel like it's mine and it's unique and it's special to me, because it should feel special to me. It's attached to me all day long. Pumpy. or whatever you decide to call it. So Fur-Elise is now forever banished from my home, or at least my pump, you know, until I change it back. But at least I have the option, which is nice.
So why is that good? I mean, it's, you know, first person. You know, she shares her story of a problem that is unique to her. It's funny. And you as a viewer, whether you're a patient or a physician or a provider or whatever, you can be able to connect with that. Let me ask you, do the people that you take care of, do they blog? Do they do videos? Do you ask them? I want to think about it. This is a little bit longer video, but I think it gets to the point. This is a medical student. And some of the most interesting stories in healthcare are when providers and physicians become patients. So her story, which she'll tell you in a lot better way than I can, a first-year medical student, right before finals week, gets diagnosed with breast cancer. Social media could not, this would be the only way to tell this story, and I'll play this video here for you.
So yeah, it started at the end of the school year. I was studying for finals and getting everything ready for the summer, and kind of hit a major roadblock that I didn't have expectations for. I have no history of breast cancer in my family. We don't even really have much of a history of cancer. So it was probably the farthest thing from my mind. I was thinking more of, okay, what specialty do I want to go into, and all of those things that most med students are thinking about. And had gone for a run and got home from my run, and I was taking off my running bag, and the strap knocked my breast. And it didn't hurt, but it didn't feel right. And it was just this very strange sensation that I couldn't really describe. And so as all good med students, we think we know everything that's going on. And so I was doing a breast exam. Do I feel something? Don't I? And it was enough that it stuck with me that I thought about it all day. And I was thinking, oh, I'm probably overreacting. It's probably nothing. But the next day, I still had this sensation. Mm-hmm. So I had my preceptor that night, and our preceptors are local doctors that we are assigned to, that we shadow all year and work on our clinical skills with. And as I was walking in with my partner from our class, I said, you're going to think I'm being so dramatic, I said, and overreacting. I said, I think I might ask her to do a breast exam. I kind of felt something and I wasn't sure, and I'm sure it's nothing, but hey, maybe you'll get to learn how to do a breast exam tonight. And he kind of laughed, and so I asked her if she would, and and at first she pulled out the gown to put on, and and I was thinking, oh, it's not that big of a deal. We don't really need to go through this. It's probably nothing. And she said, no, you're here. Let's go ahead and do it. So we went through and did the full exam, and she started on the side that I didn't feel anything, and she said, everything feels normal, everything's great. And then she went to the other side, and immediately she said, Casey, I can already feel something. And I was kind of like, oh, okay. And that wasn't the news I was expecting. And that night was actually probably the hardest night, because that night was the night I had to call my parents and tell them that I found a lump. And my dad, being a physician, was reassuring to me, saying, oh, these are normal, it happens. But something in my gut told me that this wasn't a normal thing. And I want to think that I had a good sense of it. But the doctor immediately said she wanted to do more testing on it. Mm-hmm. The next morning, the hospital called, and they had set me up for a mammogram, an ultrasound, and a biopsy. And so about 10 days later, I had those done. And I did call my mom and asked her to come down and be with me for that, because I thought, oh, it's probably nothing, but I could potentially be getting some bad news here. Sure. And so she came down, and the radiologist said there are actually 2 lumps that we found, and I would be very surprised if they were benign. Wow. And for 10 days I'd been talking to everyone, and everyone has had lumps and everyone has felt it, and so you don't have that expectation.
Right.
You know, you're thinking it's going to be a cyst or it's going to be just fibrous tissue, and to hear that, luckily he said cancer before I had to my parents, so I didn't have to be the one to tell my parents, because that was very difficult. And I have 5 brothers and sisters, and I couldn't tell them either. I made my parents tell them, because that's just news that you don't want to hear. So I had all the testing done on a Thursday, and Monday night, it was actually the Monday of finals week, of course, you know, timing is everything. And so the Monday of finals week, about 7 o'clock at night, my doctor called and said that of the 2 lumps, one of them was benign, but one was malignant. And I would have to have surgery and need to get it taken care of pretty quickly. So I met with a number of surgeons. I'm from Akron, Ohio, so I met with surgeons and oncologists up there, and then I also met with surgeons and oncologists down here in Dayton, and really tried them on for size. And I found there were a number of awesome doctors, but I found the one that was right for me. Mm-hmm. And my surgeon was down here in Dayton. So we scheduled that, and they wanted to get it done right away. And I was thinking, okay, how can I schedule this around school? And well, maybe we should do this. And you quickly learn that you don't have control of things. And this suddenly takes on the most important thing that needs to happen. Mm-hmm. School had to be put in the background. All my summer plans had to be put in the background. And I had to focus suddenly on being a patient instead of being a med student, which is not an easy transition to make. I would much rather be wearing the white coat than talking to the person in the white coat.
I'd rather be wearing the white coat than be the one talking to the person in it. This is why video is the most powerful way to tell a story in social media. If you're not doing video, look into it. Just as a follow-up, she did well. Following her treatment, got back into the curriculum the next year. And but this is something that she really felt passionate about sharing her story, not only to anybody with breast cancer, but people in her peer group. So what I'm going to do now is I'm going to ramp things up here a little bit with the few minutes that we have left. Okay, that was the why. This is the how. Okay. This is what I tell providers and physicians about how you can start doing social media. Okay, first is marketing. This is our cute little community hospital in Salem, Ohio. Okay, our big news story last week, we're building a patient tower. Woohoo! Big news. I mean, it is big news. I mean, $42 million for a little town adds big bucks. Okay? So if you're in a hospital system, you're a physician, you're a provider, whatever you are, this is free marketing. Okay? That should be the easiest way to get people to say, oh, that's interesting. And you remember, 10, 15 years ago, people were talking about, oh, what's the line item for print or for radio or for television? This is zero. Next, I talked to physicians and providers about online management. This is a whole 3-hour talk right here. Okay? But how I boil it down to physicians and providers is when they tell me, Mike, social media is a fad, it's going away. What I tell them is, go to the computer, turn it on. That little thing over there is called a mouse. Okay? Type your name, hit enter, what do you get? Okay? What a lot of physicians and providers are surprised about is that their first link is not when they were physician of the year of their town last year. Okay? It is a physician ratings site like Health Grades. Okay? And they go, oh, what's that about? And they read it and they're like, oh! Patients are talking about you and you not even know it. This is for hospitals too. If you're in a hospital, check it out. Okay? That's usually gets some physicians all worked up. And then we start a dialogue then. Next is storytelling. Okay? Saw this last week. Time Magazine. Okay? This is Wendy Sue Swanson out in Seattle. Seattle Mama Doc. Arguably the most popular pediatric blogger out there. It was funny last week when this cover came out, we're like, Wendy, write something. We want to hear what you have to say. And she's like, oh, well, you know, I'm hanging out with my boys in the morning, and I don't know if I want to do. I'm like, come on, Wendy. Tease that. She's good. So this is what she wrote about last week. Okay, go to Seattle Mama Doc. Okay, check it out. This is her story behind the cover. Okay, what she thinks about it. So whatever you're in, whatever specialty you're in, whatever news story, tell your story. The other point that I tell physicians is that not only can you tell your story, you can clarify other people's story, which may be the wrong story. I tell my family physician colleagues all the time, you know, we have let other people tell the story of family medicine for too long, and it's the wrong story. And we family docs have to try to clarify that. So tell your story, whatever it is, whatever you're passionate about. Because what you've seen today, and what you've seen anybody who gives a really good presentation, is that whatever they're passionate about is a really good presentation. It's a really good essay. So find out what you're passionate about and write about it. Okay? It could be about gardening. It could be about whatever. Social media is also about finding community. Okay? We all know about patient communities. Okay? Talk about that all the time. But providers also have communities. Physicians also have communities. You have to find out where they are. The one I'm a part of is called Family Medicine Revolution. Woohoo! And what do? We collaborate across the country. We find the passionate people out there and say, hey, you know, what is really cool in your community that we could talk about? How can I share this story with people in my community? With people like at the State House or in Washington or policymakers? How family medicine has some of the solutions to handle a broken healthcare system. That's how you find community. There's one out there for you. You have to find out what it is. And finally, you know, maybe able to see it on the widescreens here. Social media is really cool at patient education. And I'm going to play this video here for you. And how many people have seen The Hangover? Have you seen The Hangover? You may notice one of the guys in this here. This is from and funded and recorded by the American Heart Association. What? Yes. This is really good. He's not
ready.
shy.
All right. Movie.
Sounds like
Slingshot.
blind bird.
It's definitely a romantic
Wait
comedy.
beneath my wing. No, your drink.
Shirt man.
The heart attack sequel.
Going down.
Well, you can tell by the way I use my walk. I'm a woman's man. No time to talk. Music loud, really want being kicked around since I was born. Never told I don't hate, and you may look the other way, but we can try to understand.
This ever happened to you? Harmless game of charades based on film titles turning into a sudden cardiac event? Bam! Shaklacky! No? What? Think you're better than me? Well, it happens, all right? It's a real-life situation! I got my daughters here. Call 911. Push hard and fast, okay? Focus! And yes, the beat of staying alive really works. Shama!
Disco can save lives.
Yes, disco, huh? Check it out. What do you think? What? Dance party!
— 200,000 views for CPR. You're going to see a lot of organizations taking advantage of this now, okay, patient education. So you just clarify what your message is and just kind of go for it. My last slide, and we've talked about Brian Verabedian already, even though he's here, but he's not here. But when I first met him, one of the things that he told me was that physicians have a moral obligation to be on social media. Really? Why is that? And this example has been used many, many times today already. When you Google, vaccines and autism, what do you get? Especially 2 years ago, a lot of anti-vaccine stuff. But his example back then was that there are about 50,000, 60,000 members of the American Academy of Pediatrics. What if they taught each one of their members how to do one blog post a year about vaccines and autism? What would happen to that search stream? You get all the right stuff. So social media is powerful. Physicians and providers need to know about that. And how I, tell physicians about it, are things like reputation management and things. The Mayo Clinic also has, a lot of great examples of it. I tell physicians, especially primary care docs, there are things in your office that you talk about 15 times a day. This is why you should not be on antibiotics. Here's a flip cam. Do it once. Do some data research and say, hey, I know we have 3 seconds in this appointment. You should not need antibiotics. This is the short answer. If you want the long answer, go to the website. It has all kinds of good data for you. This is why physicians should do this. How do I have time to do this? My most frequent question. It's tough, okay? It's not easy, okay? I carry a full load of practice, okay? I try to weave this in when I can, okay? I can get into it a little bit later, maybe during our panel session, but there are a lot of tools out there that physicians and providers can use to try to streamline the process, to make it look like you're on Twitter all the time, even though you may be on the beach somewhere, okay? There are some good tools out there to help physicians and providers use social media, interact on social media, and this is why they should do that. So I'll entertain any questions, but what I will do is I will ask my panelists to come up front, and I will answer any questions as we kind of get ready for our panel session. But I'm happy to answer any questions before we start our panel. Yes? Yeah, the question is, are other people in my practice, do they do social media? No. But as they've seen me do more stuff, and they're like, hey, Mike, I saw this cover in my office. Like, what? Can you tell me a little bit more about it? So I've gotten some opportunities to dialogue, not only with the physicians in my practice, but for the people in my community and for physicians that I go to conferences with and talk about social media.